Welcome to Prepare to Care, the AARP podcast that provides resources and tools to help support caregivers and their families. I am your host, Charlene Hunter James. When it comes to fires, older Americans must take extra steps to stay safe. That's because statistics show that the risk of dying in a residential fire is greater as people age. Their physical and cognitive limitations are cited as the reason. If you're a caregiver, what should you do to keep yourself and the person you care for safe? Should we do things differently in this day of coronavirus? To give us some tips on staying safe, we turn to Fire Chief Samuel Peña. Thank you, Chief, for joining us.
Charlene, thank you very much for having me on your program.
Well, when it comes to keeping people who are older, 50 plus, safe, what does the person caring for them need to do, especially today?
Well, especially today, we need to understand that as we get older, as we all get older, that there are certain factors that increase our risk to susceptibility to illnesses, injuries, or other things. And I think that's the main thing to consider in everything we do, especially right now in the age of coronavirus, right? As we age, we develop certain illnesses, certainly chronic conditions that increase the risk of to us, our safety. And I think that's primarily one of the things that we need to consider as caregivers and on a personal level, is that we need to be even more cautious to maintain ourselves safe, to maintain ourselves healthy, in order not to catch this virus that can be really debilitating and deadly. With this, one thing we know about the coronavirus that we can be sure of is it's highly contagious, and it is affecting the older population more. Although now we're seeing numbers of deaths in the younger population as well, as early as 20s and 30s. So this virus is real, but we know that as we age, we are even more susceptible to those risk factors. And the key is stay healthy and prevention.
Right. How much has a firefighter's procedure changed since COVID-19 for your firefighters and the people they are trying to help? In addition, what procedures are in place for them to take care of themselves during this crisis?
Well, Charlene, I can tell you that we have had a wholesale change in our approach. In the old days, I'm going to say the old days, just last year, right? We used to, the goal was to get to your emergency as quickly as possible and rush in to make as big a positive impact as we could on the situation. And since the coronavirus, since the pandemic hit, and since we've been dealing with it this year, we've had to change our approach. We still are efficient in getting out of the door, getting to your emergency. But at the time that we arrive on scene, everything seems to just take a little slower path, right? Now, what we've told our firefighters is to assume that any patient contact, any interaction we have with our patients or at an incident, is to assume and to have a heightened sense of suspicion that that interaction can be potentially infectious, and not just infectious to our firefighters, but vice versa. We can be the source of infection to our patients. And because of that, we've taken a different approach to how we handle those scenes. Now, you will see our firefighters wear their gloves, their masks, their goggles, and limit the number of people that actually make patient contact initially until they make an assessment, right? And as I mentioned, the reason for that is the game changer in this whole pandemic was when people were able to be asymptomatic, not be displaying any symptoms of the coronavirus, and still be potentially infectious, still be shedding some of the virus. That really changed the environment for us, because a person who would look healthy, who would not be displaying any symptoms can be potentially shedding the virus and infecting other people. And that's not just our patients potentially infecting our firefighters. It could be our firefighters also spreading that virus to our patients. So because of that, with that understanding, we've changed our approach, and now everybody is required to wear the entire personal protective ensemble when they're approaching any scene. And because the goal is to limit the exposure, cross contamination, both to the patients and to the firefighters.
I'm glad to hear that. Sure. What is the leading cause of fires? And I'd like to add on to that. We know during different seasons,
Right.
they're higher risk.
Sure.
In the summer, we worry about seniors that have these window fans that are, shooting off a lot of warm air. And then in the winter, we deal with the heaters. So what can we do to educate and to prevent a blaze in the home?
Well, the leading cause of fires, and regardless of the season, is cooking fires. Cooking fires are one of the leading causes of home fires in our city. And that's as a result of being unattentive, leaving pans cooking and unattended. And so that's, regardless of the season, that's one of the call types that we always respond to. But you're exactly correct, Charlene, is that during different times of the year, we get different types of fires that also increase. For example, in the wintertime, we get space heaters that we have to deal with, right? People are misusing those space heaters, and those are very dangerous if they're not used appropriately, and if they're left unattended. Too close to combustibles, to drapes, they drape clothes over them, and especially the automatic ones, the ones that turn on and off automatically with a thermostat. Those can turn on, and if somebody accidentally leaves a piece of clothing or some combustible that's close to those units, it can spark a fire. So keeping a 3-foot separation from those space heaters all the way around is critically important. During Christmas time, we have overloaded circuits, electrical fires, right? We try to plug in as many of our bright lights into a limited number of outlets, and that causes electrical fires and other issues. We also another thing that we have to contend with, especially in the winter, is the use of candles, right? And open flames. Candles are very, very dangerous if they're left unattended. Okay, so there are other options than to use open flame candles, especially inside the home, and we recommend people to do that, to use those as well. But again, especially for seniors, cooking fires and cooking accidents are one of the main, the leading causes of home fires, and especially for our seniors, what we see is they tend to use a lot of loose clothing, and as they're cooking, as they're moving around in the kitchen. And our senses as we get older may be getting diminished a little bit, right? And we don't realize that our clothing may be too close to an open flame or some other hazard, boiling liquids and stuff, and we there's accidents that happen, can then turn into fires. So it's very important that we provide a safe environment in the kitchen, to always be aware, not to leave items on the stove unattended, and to ensure that we have an extinguisher handy, right? Because a grease fire, you can't put it out with water. All you're doing is you're just making that worse. That's very important. So having the right extinguisher accessible, and knowing how to use those extinguishers in the kitchen and in and around the home.
I know at one time there were safety checks that the fire department would conduct,
right,
for like your fire extinguishers or your smoke alarms in the homes. Are those still being done?
Well, one of the things, Charlene, that I want to make sure our community understands is that, Your neighborhood fire station is always a resource for any safety check or safety
Okay.
information that you may need. Our firefighters are very well versed on what's leading causes of fires and some of the safety things that we should be looking out for. So I recommend, if people, especially our elderly, if they want to have a firefighter come into their home and just take a look and see if are any things that they would consider or suggest for safety aspects, that they invite their firefighters over, and our firefighters would be glad to go in there and give them tips. They will certainly check your smoke detectors. Smoke detectors are a vital part of your safety. They'll make those checks, and they'll make any recommendations that they see, just by taking a look at your space and making the recommendations that'll hopefully keep you safe, and at least make them aware that there may be some things that for them to consider as well.
Okay. We mentioned physical and cognitive limitations may put older Texans and can make it more difficult for a person to react to a fire. We're talking poor eyesight, hearing loss, arthritis, and dementia. What should caregivers do to keep loved ones safe?
Well, again, I mentioned smoke detectors and carbon monoxide detectors. Those devices are critical to have in the home, and to have them placed appropriately and checked appropriately. So what I recommend is especially for our older population, is to have not only the audible ones, but they have the ones that have strobe lights on them as well, in case there is are hearing impaired or visually impaired, and they have different models that will address those limitations. That needs to be of primary concern for any caregiver, and for us personally in our home, is early detection with a smoke detector. Carbon monoxide detector is critical. The second thing that we would recommend is to talk with your relatives or caregivers about establishing a plan for evacuation from the home. Okay, having that that plan in place, practicing that plan is critically important to have that conversation. And one thing to remember is that once you're outside, stay outside. Right? Do not go back inside the home. And because tragedy can strike at any point. The key is prevention, and when we can't do that, early detection is also critical. And again, I cannot stress enough the proper use of the smoke detectors, and having those in place, because although the Houston Fire Department has good response times, we can get there between 4 to 6 minutes from the time that we're notified. Especially at night, the notification time can be several minutes, and a fire can flash over in 4 to 8 minutes, and so that's not a lot of time. But getting an early detection, getting the people inside the home notified that there is a problem and to evacuate, that's going to be critical to everybody's safety.
I'm glad to hear you talk about a plan, developing a plan, because that is so important.
Absolutely.
Let me ask this. Is there a class or a training that caregivers can take to be informed about fire safety? I know one time I went to your trailer that was on fire, and you have a term where you have to drop and roll or something.
Stop, drop, and roll, right?
Oh, that's right. Yeah. So
that's if you're on fire. That's if you're on fire, stop, drop, and roll. If your house is on fire, we just need you to roll out of there. We need you to get out.
Okay.
Yes.
All right.
But certainly we have our public education and public affairs team that is able to go out to, especially like neighborhood associations or senior centers, to give those safety classes. The American Red Cross also has a lot of very good programs on safety, especially for the elderly, that we can avail ourselves from. The AARP is certainly a wealth of information for our seniors, and on safety and other tools and resources available for our communities. But look, as a community, we have to ensure that we're seeking out those trainings and that we are reaching out and engaging with our senior population to ensure that they are safe, especially right now in this time of coronavirus, when we are preaching the physical distancing, right?
Mm-hmm.
That does not mean disconnecting from each other. That just there's different ways to stay connected and still maintain that social distancing that's appropriate now for our safety, but not sever those ties, especially with our elderly population, because they are most at risk, and they're most at risk, especially when they're by themselves.
So, Chief Peña, what are the top 3 messages that you would like to leave with us today to help seniors and their caregivers to stay safe and healthy in their homes?
Well, especially right now with the pandemic, that is the leading cause of illness right now. It leads to respiratory distress if you catch the virus, especially if you have some underlying chronic conditions. That can just exacerbate those conditions and lead to a bad outcome. So prevention is going to be the key. Preventing, keeping us safe, right? And the way we do that is 3 simple things. Until we have a vaccine, the best recommendation that we have right now is to keep ourselves safe, is to wear our masks in public, maintain that physical distancing, right, from each other, and practice proper hygiene, washing your hands often and staying healthy. I mean, those are the 3 basic things that we can do right now to try to prevent us from acquiring this virus that has been demonstrated to have a very devastating effect on all populations. So, we encourage everybody to stay safe. We encourage everybody to stay connected and to do the right thing for our community and for yourselves to stay healthy. And we will see better days. We will get through this and move forward. God willing. Yes, ma'am.
Wow. Is there a particular number that people can call if they would like to have their neighborhood fire station to come out and do a check?
Look, we can. You have the website is probably the best route. It's a wealth of information. It's HoustonFire.org, and we will everything you need to know, everything you need as far as resources will be available in our website. Just type in Houston Fire on a search engine, and it'll probably be the first item that comes up. Our website is very easy to navigate, and it's got resources there for safety. It's got if you need somebody to come out and install your smoke detector, do a check, all those things are available for our community, and we're glad to have you there, and we'll be glad to come out and help you stay safe.
Well, Chief Peña, thank you so much for joining us today. That information that you have shared is so valuable, and we'd like to say thank you to you and your staff for all the work that you're doing, not only during this crisis period, but all through the year to keep us safe here in Houston. Thank you.
Well, it's our pleasure, and thank you all for what you do, and God bless you.
We encourage you to follow the Prepare to Care podcast, iTunes, SoundCloud, or at www.aarp.org/HoustonPTC. Thanks for listening, and as always, thanks for caring.